The greater Kalamazoo area has a lot of large industrial companies as well as other large organizations, Pfizer, Eaton, Denso Manufacturing, as well as Western Michigan University. We felt it was time to reach out to MIOSHA, get them into our area, come and talk to us, not as an enforcement agency, but as a partner, a colleague, somebody we can use in the future, somebody we can build our network with, for all in the name of worker safety.
Everybody's got their coffee and their goodies? All right. I want to start by thanking Eric and Stryker for hosting this Coffee with MIOSHA event this morning. It's one of the first ones we've had in this area, so we like to get around to different parts of the state, and we're very grateful for all the different hosts across the state that host these Coffee with MIOSHAs for us. It's part of our Connecting MIOSHA to Industry initiative we've had going since 2007. This Coffee with MIOSHA events are designed to provide an informal setting for you to come and hear a little bit about what's going on with MIOSHA, current initiatives and different changes in policies, procedures, and standards, and also to meet your local MIOSHA reps, whether they're on the consultation side or enforcement side, to give you an opportunity to meet them and pick their brains and ask them questions. Let me start with MIOSHA's mission. It's pretty simple. It's what you would expect. It's to help protect the safety, health, earned wages, and fringe benefits of Michigan workers. Michigan OSHA is one of 27 state plans. Federal OSHA gives each state the opportunity to run their own health and safety program or let the feds do it. Michigan is one of 27 that run their own OSHA program. The dark brown states are those state plans that cover both private sector and public sector employees. The lighter tan states, Illinois, New York, New Jersey, Connecticut, are those that just cover public sector employees, and federal OSHA covers the private sector employees. And this map's a little out of date because we did just yet Maine is the newest state plan state to join us. And they are just going to cover the public sector employees also. What's new at MIOSHA? Well, MIOSHA in 1974 was formed when Governor Milliken signed the MIOSHA Act into law. And the implementation of the Act started in 1975. So that's why in 2015, we are celebrating our 40th anniversary of the implementation of the MIOSHA Act. And we've done a number of things this year, a lot of outreach activities. One of the things we've done is create a YouTube channel, and we're asking all of our partners out there to provide us some best practice videos that we could share on that YouTube channel. We also created a then and now photos presentation, which is available on our website. I'll show you some of the pictures from that. We also created a welcome video to explain some of the services that we provide. We also are excited because this year we did something new with our grants. We call them MyShip grants, and I'll give you some more information on those in a minute. And another first is our art contest for students, and we displayed all of those submissions at the Michigan Safety Conference this spring in Lansing. MIOSHA, like many organizations, operate under strategic plans. We have 5-year strategic plans. We're in our 4th strategic plan. We have the same 3 overarching goals in all of our strategic plans. As you can imagine, goal 1 is to reduce injuries, illnesses, and fatalities. 2 is to promote the benefits of a safety and health system. And 3 is to strengthen public confidence in MIOSHA. A little bit on our partnerships. Most of our partnerships are construction related. They're specific to a particular project. But we do have general industry partnerships. We have a long-standing one with Ford UAW. And the nice thing about partnerships is they work. The national total case incident rate in 2012 was 3.7, meaning 3.7 employees out of every 100 are injured. The Michigan total case incident rate in 2012 was 5. And on partnership sites in 2014, 1.2. So by working collaboratively with employers and employees, we do reduce those injury and illness rates. Proven. We also have lots of alliances. We have 16 active alliances currently. We had 2 new ones in 2015, one with the Central Michigan Manufacturers Association and one with the Michigan Green Industry Association. And we renewed one last year, or this year, the Michigan Laborers Training and Apprenticeship Institute. Alliances are a lot like partnerships, except they do not have an enforcement component to them. It's mostly a lot of sharing of information back and forth, and they really help us to accomplish our mission. As you can see, since 1999, which was the beginning of our strategic planning, we have reduced fatalities by 57%. But 37 is still 37 too many. We still have more work to be done. And on the injury and illness front, again, we're moving in the right direction. The latest data available is from 2013. So we went from a rate of 8.1 in 99 down to 3.7, which is a 54% reduction. But again, much more work still to be done.
I believe the information relayed by Associate Director Pickelman, along with the other MIOSHA reps, it resonates well with the employees here in the industry. It's always good to hear things face to face rather than just strictly being pushed out electronically. Having that meeting where we can all get in one room, network, collaborate, it's always for the better.